So from our start in this journey in 2015, we were working with our nursing colleagues because they were tired of carrying multiple devices on their belts, if you will, and said, can we please go to some sort of smartphone solution? So at that time, we integrated our smartphones along with whatever else we could use that touches the patient. So we integrated the nurse call system, we integrated our monitors, we integrated the EMR as far as lab results, critical results, discharge orders. So the integration that we have with the Connexall system, allowing us to take something that's patient-centric and putting it directly to the nurse that's caring for that patient, or the pharmacist, or the provider, or the case manager, social worker, respiratory therapist. We pretty much have the entire care team connected with Connexall, and it's patient-specific, meaning if I'm taking care of this patient, I only get alarms and alerts for that particular patient, not all of a particular unit, or it only alarms me on certain elements as well. For example, if I believe that that's an actionable alarm, we look for all the myriad of alarms a patient can have and identify those that are actionable, and then send that to the appropriate caregiver that can do something about that. On September 10th of this year at 11:23, I am from the city of Sioux Falls, South Dakota, and we were lucky enough through that night towards September 11th of all dates to have 3 individual EF2 tornadoes that hit our areas within the city. After the aftermath of that tornado, which is only about 5 to 10 minutes, 37 buildings were uninhabitable. 4 actually of those buildings were part of the Avera Health Network. One was our Avera Heart Hospital that had a tremendous amount of glass blown in on it. However, we were able to recover that building within the next day and still utilize it. Then our corporate offices had all of its windows blown out. We had to relocate those people as of today, in September 24th, I believe. They are still working on that building. And probably the most important was we had a behavioral health facility. There were 102 patients in that facility, and they had 10 minutes to get to a place of safety. And we were able to come out of that with only 7 minor injuries of that group of patients. We then had to figure out how we can take care of them. So without the prior integration and integration of the Connexall system along with the various different network pieces we have for our computers, that just would have been impossible.